Hi, everyone, and welcome to tonight's webinar, Privacy 101 Back to Basics. And tonight we're talking about security and access to My Health Record. Thank you so much for finding the time to dial in. My name is Jenny Snigavaya. I am the Acting Manager for Education at the Australian Digital Health Agency, and we'll be kicking off today's presentation. Today, I am also joined by the Director of the Compliance Outreach Team at the Australian Digital Health Agency, Jenny McDonald, and a practice support pharmacist, Amanda Cito. So welcome, everyone, and I hope you enjoy tonight's session. Before we begin, I would like to acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea, and community. I pay my respects to them and their cultures and to elders past, present, and emerging. So on the agenda for today, we'd really like to quickly cover My Health Record and provide you a bit of an overview about it. Then we'll also talk about some of the privacy features and access controls that are available in My Health Records for patients to set. And we'll also very closely look at the emergency access function that is associated with those access controls as well. We will also be chatting about the pharmacy owner's role in supporting security and access to the My Health Record system. So we'll have Amanda joining us later in the session to talk about some of the My Health Record requirements, discuss what resources are available to support pharmacists with establishing their security and access policies. We'll touch on what resources are available to you in terms of templates that you can use and direct you to some options for staff training. So hopefully tonight we do also have some time for Q&A. So for those of you who are dialing in, you do have the option to send us through some questions using the Q&A function, and we'll have a look at those towards the end of the session and do our best to try and respond to your questions. If there's any questions we can't address, we'll look at following up with you after the session, and we are making sure that we record today's presentation, and we'll be looking at sharing that with you after tonight's webinar as well, if you'd like to play this back or access any of the resources that we're going to be sharing tonight. So let's dive in. Hopefully most of you on the line today already know a little bit about My Health Record. It is an online summary of an individual's key health information. It is part of a national system, so it's available to healthcare providers, to consumers all across Australia. The really great thing about it is that it is accessible at all times. So it provides consumers and their healthcare providers to access to some of those key bits of information about their health at all times. Public holidays, weekends, after hours, especially in kind of situations when it might be difficult for you to access information from other sources. So it can be very useful tool in providing healthcare to patients across Australia. My Health Record is also something that is personally controlled. So patients actually have a lot of control. They have a say in terms of what information gets shared with their My Health Record, what stays in their My Health Record, and who can access that information. So there's a lot of privacy and security functions built into the system to protect the information that's contained within. And it is something that patients can control themselves as well. It is also something that is highly protected. So there's a lot of legislation that supports and kind of governs the use of the My Health Record system. So we'll be mentioning some of those bits of legislation in today's session. One of those legislative pieces is the My Health Record Act, which highlights and outlines who can access My Health Record information. So This legislation provides authority to healthcare providers, those who are delivering healthcare to a patient where they have been authorized by their organization to have access to the system. Those clinicians have authority to view a patient's My Health record. They also have authority to upload information to a patient's record. Now, there are some additional kind of rules around it, which you can see on the slide. And if you are interested in learning more about accessing My Health record, there's a lot of resources that are available on the agency's website and in our e-learning modules as well. So I would encourage you to have a look at that if you are not familiar with kind of the permissions for accessing My Health record. But as a general rule of thumb, there is legislation that supports you and provides you authority with viewing a patient's record, where you're directly kind of providing healthcare services to them, where you are authorized by your organization. And this access is also subject to patient access controls. So let's have a look at some of those controls that patients can set to their My Health record. In situations where they may wish to kind of control access or restrict access to certain information in their record, because we have to remember it is a personally controlled environment, so to speak. So one of the access controls is that patients can actually choose to restrict access to specific documents in their record. There's millions of documents in the My Health record system. There's a lot of information in each individual's record. So they can choose specific documents or bits of information, and they can choose to restrict them if they wish. Now, if they do want to provide their clinician with access to this information, they can set something called a limited document access code, or an LDAC for short. They can set a code, and they can choose to provide that code to their healthcare provider, and that will give them access to those restricted documents. Another control that they can apply is if they wish to restrict access to their entire record. So it might be an individual that's perfectly happy with having My Health record. They want information to be available in their record to support, I guess, provision of care to them when they visit their healthcare provider, but they may want to have a say in terms of who can actually view their information. So they can restrict access to their record. Again, they can set a record access code, and they can choose to provide that code to their healthcare provider, and it will allow that organization with access to their record. And it's completely up to the patient to decide whether or not to provide any of those codes to their healthcare provider. They can also set a number of notifications to their records. They may wish to be notified via an SMS or an email. They can set kind of alerts to be notified when their record has been accessed. There is also a provision for gaining temporary access to restricted records. In the My Health record system, it's called the break glass function or the emergency access function. So we'll have a look at that in a bit more detail in a minute, but that can provide temporary access to restricted records. And all access to My Health record is monitored, it's recorded, so individuals can actually go and have a look at their own My Health record. They can view their access history and see what documents have been accessed and what organizations have accessed their information. So there's a lot of controls that patients can set if they choose to restrict access to their record, or if they want to be kind of notified when their information has been accessed. So you might be wondering, how will you know? As a pharmacist out there, you've got your clinical dispensing software that you're using on a daily basis, and you might be wanting to access someone's My Health record to double check their medicines history or their allergies in My Health record, but you might not really know whether someone has a restricted record or not. So your dispensing software will actually prompt you. So you would all know that all dispensing platforms out there differ slightly in their functionality, but they all perform the same thing. The same applies to My Health record. So in every dispensing software product, in most of them, there would be a way for you to access My Health record. And usually there is an icon that you can click on that will provide you access, and it will take you to the patient's documents list. It might look different in different software platforms, but usually there would be an icon, and there would be an indicator around that icon. There might be a color-coded kind of prompt to let you know what kind of access would you have to an individual's My Health record. It might be a green border around the My Health record button, as an example, that usually indicates that a person doesn't have any access controls. It might be an orange border that would indicate that they may have some restricted documents. Alternatively, might be a red border that might indicate that they actually have a restricted My Health record. So check in with your software provider to see what those colors mean, and just check how access to My Health record works in your particular software that you use. But generally speaking, there would be an indicator, and you'll be kind of prompted, and there'll be some hints, I guess, provided to you through your software to alert you to the fact that a patient might have an access kind of control that they've set. So this here on the screen is just an example of a prompt that you might get when you click on the My Health record icon. So in here, if you can tell that a person doesn't have any restrictions, you can check, you can choose the general access setting, and you can view the patient's My Health record document list. If you have been provided with an access code by the patient, whether it's for limited documents, for restricted documents, or for their whole record, if the patient's provided you with a code, you can enter it in the box, click OK, and proceed, and you'll gain access to those restricted documents as well. There is also, as I mentioned, the emergency access function, which is something you can use if you can meet very specific criteria. This is outlined by a very specific section of the My Health Records Act. I believe it's section 64, which goes into the detail of what criteria you need to meet, which would let you bypass those restrictions that have been set by the patient. So on this note, I'm going to hand over to Jenny McDonald, who will take us through how to lawfully use the emergency access function, and let you know a bit more about the agency's role in kind of monitoring that.
Thanks very much, Jenny. As Jenny said earlier, I'm the Director of Compliance Outreach here at the agency. So Jenny's mentioned that there's a box that you'll have on your screen outlining the different types of access that you can have to a person's My Health record. If you were to click the emergency access button that's visible on your screen on the left-hand side, you would receive a warning screen or a pop-up box that outlines the requirements of emergency access at a very high level. Jenny mentioned earlier that providers are authorised to access information in a person's My Health record for the purpose of providing healthcare, but that the access must be in accordance with any access controls. So for this reason, it's really important that you don't use the break glass function, which is bypassing the access controls, unless the legislative provisions are met, which I'll go through in a moment. So it's really important that you read the message that pops up on your screen, that you only enter yes or click OK, depending on the software package, if the access relates to lessening or preventing a serious threat to a person's life, health and safety. Or in other words, if the access does not relate to lessening or preventing a serious threat to a person's life, health or safety, it's really important that you don't proceed. And if you realise that actually you don't need to proceed, you would just click the X in the top right-hand corner. So the emergency access provision, there's very specific requirements outlined in the My Health Records Act, and they're summarised on the screen here. So emergency access can only be used if the healthcare provider reasonably believes that the access is necessary to lessen or prevent a serious threat to the life, health and safety of a person, and that it's unreasonable or impractical to obtain the consent of that healthcare recipient. Or if it relates to public health or safety, then the healthcare provider must reasonably believe that access to that particular record is necessary to lessen or prevent a serious threat to public health or public safety. So they're quite specific requirements that need to be met in order for that emergency access provision to be lawfully used. So as you can see from the previous examples, healthcare providers are prompted to accept a warning before emergency access is activated. And before proceeding, it's really important to make sure that you have ensured that those requirements have been met. Emergency access lasts for a maximum of 5 days and it's visible to the healthcare recipient. They can have a look in their access history in their My Health record and they can see that emergency access has been used. In addition, healthcare consumers can elect to receive notifications via either SMS or email when certain events occur with their My Health record, and that includes emergency access. And in addition, the agency monitors all use of emergency access actively in our role as the system operator for the My Health record system. So the agency may contact healthcare provider organisations, including pharmacists, in relation to their use of the emergency access provision. So to enable pharmacies to respond to inquiries about emergency access, it's strongly recommended that organisations maintain records of when they've used emergency access and why. So we may contact an organisation because, for example, a consumer has contacted the agency with concerns regarding why a particular pharmacy has used emergency access, or as a result of the agency's monitoring activities. For example, we currently review emergency access at the end of each month and send letters to a selection of healthcare provider organisations, including pharmacies, that use the emergency access function during that month. In determining who to send letters to, we consider various different factors, such as the number of times emergency access occurred in that given period, the type of organisation, for example, pharmacy, hospital, general practice, etc., and what types of access controls were set by the individuals whose records were accessed. The primary aim of the letters that we send to organisations is to raise awareness of the emergency access function and how to use it when it can lawfully be used. We also remind organisations of their data breach reporting obligations under the My Health Records Act, which are slightly different to the data breach provisions under the Privacy Act. It's important to note that a letter can be received regarding use of emergency access by any organisation that uses the emergency access function. And just because an organisation receives the letter, that doesn't mean that the agency has determined that any wrongdoing has occurred. So in other words, an organisation may have a legitimate reason for using emergency access in line with the legislation, and they may still receive a letter. And this is because the agency doesn't know why a particular organisation has used emergency access. We just know that the function has been used. So if you receive a letter and have questions about the letter or the contents contained within it, you're very welcome to reach out to the compliance team using the contact details contained in the letter. I would say at this point that the agency considers that use of the emergency access function in a pharmacy setting would be very rare. Almost all access to the My Health record in a pharmacy should be able to occur without the need for emergency access. When an organisation receives a letter regarding their use of the emergency access function, they should review the information in the letter and consider whether the access was authorised. They should also consider whether they need to submit a data breach notification under the My Health Record legislation. And as mentioned previously, just because you receive a letter doesn't mean that those obligations have arisen, but it means you need to have a look at it and consider the use that's been outlined in the letter. So a key aim of our monitoring activities and the letters that we send to organisations, as I mentioned previously, is to raise awareness of appropriate use of the emergency access function. We would ask that all pharmacies ensure they provide appropriate training to staff, and we have a range of education and guidance materials that can assist you with understanding the emergency access function. The agency provides an overview on our digital health website. There's also a podcast available. We have webinars that the education team runs regularly to assist healthcare providers to understand how and when to use the emergency access function. Currently, we've got webinars planned for June, July, August and September in the second week. And you can access them via information on our website. Also, the Office of the Australian Information Commissioner, who is the privacy regulator for the My Health Record system, has a range of resources available on their website, including a frequently asked questions document and a flowchart regarding use of emergency access. So we would encourage you to share these resources with your colleagues. In addition, if you receive a letter regarding particular use of the emergency access function, or you know of somebody who has received a letter, it would be a timely opportunity to remind staff about the resources that are available and to ask them to review these resources to ensure their understanding is complete. We're currently working as well to develop some additional resources, including some cheat sheets to explain where the emergency access function is in different pharmacy software packages, and we will provide further advice once these additional resources are available. And so I will hand back over to Jenny, who will introduce the next part of the webinar.
Thank you so much. So on this note, I would like to invite Amanda to talk to us about the fact that there is additional kind of legislative requirements on pharmacies that need to be met for those pharmacies that are using My Health Record, on staff that are accessing My Health Record. So can you talk to us, please, about the pharmacy owner's kind of role in helping everyone in the pharmacy understand what those obligations are?
Sure, Jenny, and thanks for having me on tonight, and thanks everyone for joining us this evening after a long day at work. So yes, I'm going to be talking about the compliance requirements, and hopefully if you go through all of these requirements and meet them, then you will avoid getting one of those letters that Jenny was talking about earlier. In my role as a practice support pharmacist, I have supported a couple of pharmacists who have received this letter. So also speaking from experience when talking about this. So I'd like to think that most of you who have joined the call tonight have already registered and are using My Health Record, but it's just good to go through all the steps that you need to complete beforehand. And just in case you've connected to My Health Record and forgotten to do these steps, it's never too late to do that. So as Jenny said, there's a range of obligations for organisations to meet, and one of the first is to establish a security and access policy, and it's really important to have this policy in place prior to participating, if possible, and because you are required to declare that you have this policy in place before you connect. So as part of that, you do need to consider who's going to be your RO, your responsible officer, and your organisation maintenance officers. So usually the RO would be the pharmacy owner who has full control over the profile of the organisation in PRODA, and then the RO can nominate a number, so one or more organisation maintenance officers. So people such as your pharmacy managers, or other pharmacists in charge who are regularly working at your business could be the OMO. So that policy covers a range of prescribed matters, and those matters must be communicated to accessible by and enforced with the employees and healthcare providers with whom the organisation supplies services under. So it's really important to create to do that compliant policy. And now the Office of Australian Information Commissioner, in collaboration with the agency, has developed a new templated security and access policy. So in a couple of slides' time, and I'm sure in the email that's following up afterwards, we'll pop up the link to that template so that you can download it and use that to help you develop your compliant policy. But some of the features within the policy is how your organisation connects to My Health Record, and for most of us, it's through our dispense software. Who provides the access to the staff, that being the RO and the OMO, and outlining what training is provided as well to your staff who access My Health Record. And there are also ongoing obligations as well. So obviously, once you register for My Health Record, you have to set up that user access, and so your OMOs can do that, or the RO can do that. And then you've got your ongoing requirements as well. So it's required that annually you review that security and access policy. And my little handy tip is to try and set an anniversary for that around QCPP time, because in the next slide you'll see that the use of digital health tools is now a component of QCPP. And when you are doing your assessments, that you have to demonstrate that you have that compliant policy as well. If you can just pop back for a moment, Jenny, I'll just go through those last couple of things. So you also are required to respond and comply to any assistance that's made by the system operator, and comply with any notifiable data breach requirements. So Jenny spoke a little bit about those data breaches before, and for the pharmacists that I helped, it was a good reminder to review all of our policies and make sure that training was up to date as well. The letter that you do get, the wording is very, for lack of a better term, lawyerly. So it is in legal type writing. So I do recommend, if you see one of those letters, sit down in a quiet room and take a moment to try and digest the information in there. The compliance team at the agency are really super helpful. So if you are having trouble digesting that letter or understanding what is required of you, then please don't hesitate to give them a call, because they are there to help pharmacies get through that letter and understand what is required of them and their reporting obligations. And it's important to also be aware of your, if you determine that emergency access was used and it didn't meet those requirements that Jenny mentioned in that previous slide, then it does become a mandatory notifiable data breach, because the threshold for that under the My Health Record Act is actually lower than what it is under the Privacy Act. So, the team really helped me understand that, and so I was able to get some guidance on finishing that process. So with quality care, there are 2 steps that need to be satisfied when you're doing your QCPP. On the next slide. Thanks, Jenny. And so I'll just go to the second one first. And so it does say to establish and implement a policy. And that's basically everything that is already detailed in your security and access policy. So if you meet the requirements of setting up My Health Record, then you're already going to tick the box for QCPP. So that's really handy. And also the first step, ensuring all your staff members who have access to the My Health Record have access to that security and access policy and have undergone adequate training. My suggestion is to make sure that it's part of the induction process, that they either complete a training, and we've got some links to some training coming up soon, or if they've transferred from another pharmacy and they've already done the training, that they demonstrate to you that they have completed that by just having that certificate of completion. It does also mention in the column on the right about including pharmacy assistants. My recommendation is to well, in my business, I don't allow pharmacy assistants to access my health record. You do need a HPII to access my health record, and you shouldn't be sharing those passwords anyway. And my health record should really only be accessed in the provision of healthcare to a patient, which a pharmacist obviously would be involved with. So I would only provide access to pharmacists in that situation. So then on the next slide, we've just got some information there about some handy links for you, which you will get in your email. So the first one is where you access the template for the security and access policy, and you need to go through the OAIC website to access that one. There's also further support in developing a security and access policy, and there's an e-learning module there if you need assistance with doing that. There's a link to the My Health Records rule, and also down the bottom is a list of staff training options as well. So if you're having trouble finding some training for your staff to complete, then you can go to this website. And a little plug for Guild Ed Education. There are some really good modules on there as well that your staff can complete for free. So I'll hand back over to Jenny now to wrap things up and see if we've got any questions from the audience.
Sounds really good. Thank you so much for just highlighting the wide range of resources that are available, and hopefully those of you on the line today can spend some time having a look at them and upskilling on some of those functions that we have mentioned tonight. There have been a couple of questions that have come through, so thankfully we've still got a bit of time to go through them. I'll read out the first one, and I think I should be able to address this one myself. But the question is, if a patient asks for a particular medication not to be uploaded to my health record and it accidentally has been uploaded, can we remove an upload? It's a great question, and absolutely. There's a couple of points there. So I mentioned at the beginning the authority that in most cases pharmacists have for accessing a patient's My Health record and for uploading information to their record as well. But if we are ever requested by a patient not to upload information, we do actually need to comply with that request as well. So we need to make sure if somebody ever asks for a piece of information not to be uploaded to a record, we need to make sure we know how to stop that from happening. If it does happen in your software, you do have the option to remove it, yes. So if we're talking specifically about a dispense record that has been uploaded, usually in most software, you can go back into that particular dispensing, you can edit it, and you can change kind of the upload settings, and you can that will automatically kind of update the patient's My Health record and remove something if it wasn't kind of meant to be there, or if you delete a dispensing, that will also remove the document from My Health record. And if you're not sure how to do that, again, I would encourage those of you on the line to have a look at some resources by your software provider to check how do some of those functions work. Make sure you understand how is it that your pharmacy is uploading dispense records. Usually those pieces of information are uploaded almost by default. So there's a lot of dispense record information in the system. So it is very important that staff are educated on how to prevent a dispense record from being uploaded if ever requested, along with some of those other functions. Like we mentioned earlier, patient controls or emergency access buttons. I think it is really great to direct your staff to some of those materials that we have online, to some of the e-learning modules and other resources that we have available. But sometimes it goes a really long way when you can see something in your software, if somebody can just show you how a certain function works. So I think it's a great opportunity to kind of gather everyone around, a computer when there is that opportunity, and just, show someone where is the icon to access my health record, how to upload something, how not to upload something to my health record. I think it goes a really long way to see exactly how those things work in your particular dispensing software and practically kind of show everyone. And on that note, I would also mention that we have training environments available for this on the agency's website as well. If you can't find it, reach out to us at the agency. We're happy to point you in the right direction. But we do have some training environments available, so you can actually jump into a dispensing software platform and play around with it without needing to ever access anybody's My Health record, because as we've mentioned, all access to My Health record is monitored. So never use kind of real patients' records for any kind of demonstration purposes, but there are tools available to support your pharmacies in doing that. Another question is, can access be set to allow once-off access? Another great question. Generally speaking, when a patient has set an access restriction on their record and they have chosen to provide the code to the organisation, I believe the organisation as a whole has access to that individual's record for approximately 3 years. And if Jenny, you want to correct me on this, feel free to do so. But I believe there's a set period for which an organisation has access to that individual's record if they've been given a code. Am I saying that correctly, Jenny?
Yes, also individuals can go in though and manage their access of any organisations that have accessed their record previously. They can go into their record and choose to remove those organisations at any time.
Yeah, absolutely. Yeah, that is also an option, which is a great tool in My Health record. For majority of people on the line today, it's highly likely that you have a My Health record of your own. You can access it and you can have a look at it yourself. You can see what documents are in there, and you can absolutely go in and set restrictions if you'd like. That is all available, and you have different ways of accessing My Health record. You can access it online through your MyGov account, or the agency recently released the My Health app as well. So it's a mobile phone application that you can access, and you can see what information is contained in your record. So hopefully that answers the question that's come through. Another great question is, can My Health record be hacked? Controls are only good for those who play by the rules. And to ease everyone's minds, the Australian Digital Health Agency is a system operator for My Health record. And we have a cybersecurity centre that monitors all activity. It looks at My Health record access 24/7, and they look at kind of all access into the system and ensure that information that is stored is kept secure. So other than patient controls, there's a whole other side to the agency that looks after the whole system and ensures that there's very strict kind of security, protocols in place, and they monitor all activity. Another question I thought I'd raise maybe with you, Jenny, is if a pharmacist has used the emergency access function, what are potentially some of the things that they can do, I guess, after they've used the function? Is there something that they should kind of record or notify someone? What should they do if emergency access function was used?
I'm afraid, Jenny, my connection just dropped out, so
Oh.
I missed the beginning of the question.
All right. Hopefully you can stay on for a second longer, but the question was about using the emergency access function, and if somebody did use it, what are some things they should kind of record after the incident to keep kind of what records, I guess, should they keep?
Yeah, look, it's a good idea to just keep a brief summary of how the situation met the legislative provisions. So outline why the access was necessary to lessen or prevent a serious threat to a person's life, health or safety, and indicate why it wasn't practicable for the person to provide you with their access code, so that you could access the record using the regular access methods. So normally most people don't have access controls set on their record. So for the vast majority of people, you're going to be able to access their record anyway. If there are access controls in place, you only want to be accessing their record using emergency access if that is necessary to lessen or prevent a serious threat. So the records should outline how the situation met that requirement. Yeah.
Perfect. Thank you so much. Another question is it up to pharmacy assistants when taking in a script to ask if scripts are okay to be uploaded to My Health Record? So this again brings us back to the very beginning of the presentation around the My Health Records Act rules surrounding authority for access. So if a pharmacy is registered with My Health Record, if they have provided access, they've given permission to their staff to view My Health Record, to upload information to My Health Record. If a individual is involved in delivering healthcare to a patient, which obviously if you're dispensing a script, you are providing healthcare services to a patient. And yeah, subject to those access kind of controls that we mentioned earlier, organizations and clinicians have authority to upload information to My Health Record to view without having to ask for permission every time. So there's already existing kind of permissions built into legislation that allow pharmacies, yeah, almost by default in most situations, to upload dispensing records to someone's My Health Record. So no, it is not up to the pharmacy assistants to ask every time somebody comes in and hands a script in about whether or not the patient is happy with information to be uploaded. Pharmacies generally already have permission to do that under legislation, provided the patient hasn't requested, hasn't specifically told the pharmacy assistant that they don't want that to happen. If they do that, you do need to comply with that request. But I'll let Jenny also touch on that if there's anything else you want to add.
Just to add that some states and territories do have particular legislation that that places controls over particular types of information. For example, in some states and territories, there's particular controls around when you can share information about a person's HIV status. So there may be some things to be aware of in regard to particular types of information for your particular state or territory. So there's a little bit of information on the My Health Record the digital health website that provides some additional information regarding that. But yes, generally speaking, you can upload, and unless one of those apply or the person has said that they don't want you to upload.
Yeah, absolutely. Thank you. If we get an emergency access letter, should we also contact our professional indemnity insurer? Is that a good idea? Amanda, did you want to add or respond to this one?
Sure. So if you determine that the emergency access obligations were not met and it does become a notifiable access, then I think it's probably a good idea to notify your indemnity insurance provider. That's what we've certainly done in the situations that we have managed, because if the breach has occurred, then we notify the system operator, and then the system operator then notifies the patient that the quote unquote data breach or the emergency access has occurred. So I think to protect yourself and for the organisation that you work for, if you're an employee, it would be a good idea to do that. And also, your indemnity insurance provider can provide you with any further advice that you might need as well. Good question.
And last one probably that we have time for tonight, and not so much a question, maybe a comment that I'll read out that someone sent through, is that their dispensing software has date-stamped recording function in the patient notes. This can't be deleted or altered, and it can document an incident report and keep with QCPP records, which I think is a great function. It records kind of any access, and yeah, if there is some kind of incident, it seems like there's automatic kind of functionality built into your software, which I think is great. And for anyone on the line tonight, I think, yeah, it's a good opportunity to kind of review any resources that might be available through your software provider, your dispensing software provider, and learn a little bit more about the functionality you have in your software that's related to My Health Record. Especially around the emergency access function as well, around how your software uploads records, how to stop them uploading. It's really important to know how it all works in your software and share that information with your colleagues. So I think we might need to wrap it up here this evening. I know there's another session booked in for later tonight, which I think a lot of you will be dialing into as well. So we'll give everyone a 15-minute break before the next webinar, but I would like to thank Amanda and Jenny for your time this evening, for sharing with us some tips on how to meet obligations from a pharmacy perspective that are related to My Health Record, and how to appropriately use functions like emergency access in My Health Record, and ensure that we are accessing My Health Record and respecting any controls that patients may have set to their record. If anybody has any questions after tonight's session about anything that we've discussed, we'll send out a copy of the recording and the presentation slide and links to some resources as well. But if you ever do have any questions, do reach out to the agency. Our website is digitalhealth.gov.au. We have a helpline that you're welcome to contact us on if you do have any questions. And we really hope that you access some of our education materials and reach out to us in the future if you'd like to learn more about My Health Record. So thank you so much, everyone, for your time this evening, and have a good night. Thank you.